Welcome to Planetary Health First, Mars Next. It is going to be an amazing journey today. Hope you're ready for liftoff. We are live now. Well, it's an awesome day. We are here at Planetary Health First, Mars Next. I'm Michael Mann, the host and producer of this little thing, but we have an amazing special guest, Costin, and we are going to get going into some super important technology solutions for older adults, specifically supporting the older adult population in their 80s. And before we get going, let's just share a little bit with OnScreen. We got a little video. I think a video is worth 1,000, whatever, let's say 1,000,000 information insights.
Yeah.
So let me get that recorded, and then we'll get going. Introduce you with the founder, CEO, Costin.
Hi, my name is Costin Tuculescu, and I am the CEO and co-founder of OnScreen. We enable older adults to stay connected with family, caregivers, and healthcare using the TV as a platform for video communication, engagement, telehealth, and companionship. Our solution removes all the technical barriers and provides the simplest and best video calling experience on the TV. We also enable frictionless telehealth visits from doctors, nurses, and other care professionals through the TV, creating a window into the home of the older adult. Additionally, we enable social interaction like virtual yoga classes, book clubs, and many others, reducing loneliness and isolation. Finally, we're launching an AI companion on the TV named Joy, who can be a 24/7 source of comfort, always available to chat, joke around, and discuss almost any topics. Joy can also constantly assess the well-being and the needs of the older adult and act as a care coordinator, bringing in family and healthcare professionals as needed. I believe that turning the TV into a platform to support our aging population can have a profound positive impact, and I hope you agree. I look forward to hearing from you.
You want to start a little bit about you, your background, because I got interested with you from your previous background as a founder. You've exited in the OnScreen kind of the go-to meeting thing, and you were taking that technology and leveraging your serial entrepreneur success into healthcare. So tell us a little bit about you, your background, and why you would be a great person for any venture group or any partnerships in the healthcare space with what you're doing.
Yeah, awesome. And Michael, thanks for having me on the show. It's great to be here, and really appreciate it. So my background, I've been a serial entrepreneur for probably about 20 years now. I started off originally as a computer science guy, as a coder, developer, and then I started building some webcasting applications and webinar applications. I started a company called anymeeting.com. That was a freemium webinar and online meeting platform, and that one did pretty well. It got acquired in 2017. No one could have foreseen the pandemic, which 10x'd all video conferencing everywhere. And then, Zoom became a household name like Kleenex. So, just kind of, you could never time the market on these things. Could have waited 3 more years. But that's how life goes. So, with my video conferencing background and experience during COVID, I was just still seeing how many people struggle to get connected, especially older adults. And I was also thinking, why are we all huddling around these tiny screens, tablets, laptops, when just about everybody I know has at least a 60-inch TV, pristine, giant, beautiful TV in their living room? They could sit on the couch and talk to their family. So I got together with one of my co-founders, and we looked at how we can make this happen. And we put some products out there, like some super rough MVPs. We put them on Amazon. And the people that were really leaning into this kind of a product were the 50-year-old children of 80-year-old seniors. And because basically they wanted to see their parents, they want to see their mom and dad, make sure that they're doing okay, but their parents couldn't use a tablet, couldn't use a smartphone, Zoom, all of that good stuff. So we just really leaned into that demographic. And I don't have a background in healthcare or in gerontology or senior care, but it became fascinating to me that, there's over 13 million 80-year-olds in the US. 95% of them have chronic conditions, health conditions. A lot of them struggle with technology. And then I also have 75-year-old parents. And while my mom, for example, she's on Facebook all day long, I know that there may be a time coming soon in the next few years where this technology is going to help them as well. So I kind of have a personal gain here from all of this work. So that's my background, and really excited about getting into age tech and pushing this forward.
And now you have something coming up, correct? You're going to CES and doing something with AARP, right?
Yeah, I am super excited that, this week, AARP is a phenomenal organization, largest association of seniors in the country, and they're huge advocates. Obviously, everybody knows AARP. But what folks may not know is that they also have this AgeTech Collaborative, which is an organization that they put together made up of investors, industry leaders, thought leaders to push technology and solutions for aging forward. And they have this enormous 12,000 square foot booth at CES where they feature quite a few age tech startups. And we were one of the finalists selected to be in their Age Tech After Dark pitch competition, which I know sounds super duper sexy. And I can't wait to get all of that Age Tech After Dark action going in Vegas at the Palazzo, I think it is. So this week's going to be a lot of fun.
Merlot's, a little bit of vino included or something, right?
Probably. Knowing Vegas, that's the least of it.
That is cool. So how many other organizations, are they having several other different categories? Tell me a little bit about the venue.
Yeah, so in this competition, we are fortunate to be 1 out of 5. So there's only 4 other startups and OnScreen, and there is a $10,000 prize for the winning company based on our relevance to age tech, our impact on age tech, our traction and team, etc. So it's going to be really exciting for all the companies to participate. There's a lot of attention to this event, and it's really meaningful in the age tech space. But also, I think the winner is going to get also a lot of positive attention. So I'm pumped. I'm practicing my pitch in the mirror every day while I'm brushing my teeth. And I'll keep your fingers crossed for me, Michael.
No, this is great. So what is it, like about 10 minutes? How do they keep it at 10, 15 minutes or a 3-minute like elevator? What is it?
It's rough, man. It is a 3-minute pitch where you got to cover the problem, the solution, the traction, the team, and just make a really compelling story by a company in 3 minutes. And I'm pretty sure they have one of those big old Vegas club bouncers that if you're at 3:01, you just whoosh, you're getting pulled off the stage, gong show style.
That's cool. And then they add like maybe 10 minutes for questions by judges. Is that sort of what's going on, or?
So there's no Q&A at this. There's, I think, a little bit of audience voting using a mobile app. They did do a really cool thing where they got the pitches together in front of the judges last week. And the judges had the opportunity to ask questions and clarify, get to know the companies. So, it's such a top-notch production that they put together. I think anyone who's in the age tech space and will be at CES, they won't want to miss this event. It's kind of where you want to be.
Yeah, no, absolutely. I mean, when you think of AARP, I guess they start, I think, 50 years old, 55, I don't know, but mainly, of course, the tsunami is at 65 and plus because you get the Medicare Advantage age. So, gosh, it must touch what, a third of America, the population.
Yeah. Yeah, I don't know the exact number, but I think they have at least like 40 to 50 million members,
Hmm.
right?
Yeah. So
And huge advocate group. They help set policy in Washington. So, just to even be in the conversation, be part of the 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 thing that they are drawing and pulling people together to, it's a huge opportunity for OnScreen. And to be honest, like our solution is really kind of disruptive, and it's something that people don't really think about. Like, wait, you can use your TV to talk to a doctor. You can use your TV to see your grandkids and chat with them. You can get text messages and reminders on your TV. I was just like really fascinated with the fact that everybody has a TV. It's the most comfortable screen and technology for older adults, yet it's not being used to help them in any way other than to just kind of like sit there and just get brainwashed all day long. So, because it's such a new concept, we have to do a lot of education to the market. No one's out there Googling TV based video calls or TV based telehealth for 80-year-olds. So we're really trying to get the word out, and AARP,
yeah.
it's a phenomenal launch pad for us.
Yeah, no, this is great, and I feel fortunate that we stumbled across each other almost a year and a half ago. Got to know your product, your solution, the evolution of it, and the little bit that I know of, and maybe this is a great starting point to help others listening. Like, what is this OnScreen? But what I gather is you have a way. It's a hardware integrator. It's a hardware system that you basically anyone. That adult child can set up their TV to then become an interactive, kind of like becomes your phone, if you would, to do FaceTime for mom or dad. And then the applications that you're working on is really cool. The user experiences where healthcare organizations can do different screenings, they can do telehealth augmentation. But the real thing is, most people, and I know I have an 85-year-old mother and 91-year-old father, they can't do anything. My mom 85 can do texting. But this is the sort of thing that is like, I would say, I call it like the source of truth, right? Because you can get to everything and anything through this TV. And so I'm going to stop there because this is your show. This is your time on the show. Just if you want to go ahead and kind of walk us through a little bit of the product and what you're solving and the challenges currently in the marketplace and why this is so important.
Yeah, that's awesome. So just as you mentioned, we've built this small piece of hardware here that has a built-in camera. It's got microphones. And if you could set up a Roku on a TV, which I'm sure, Michael, you can, most people in their 40s and 50s and 60s can, although 80 plus, they do have challenges with that. So it's usually the younger child, or we're looking for partnerships with like Geek Squad or something like that. But you hook this thing up to the TV, and now it's a communication, the TV becomes a communication platform. And that communication can happen with family, can happen with healthcare, and can happen with caregivers. And it can also happen with peers. So let me walk through all of those three different pillars. So with family, we usually have one main person that's in charge of setting it up for their parents. And once they set it up, they can invite brothers, sisters, cousins, siblings. They can even invite their teenagers that have smartphones. And now all of those folks can place a call to grandma. And what happens is, grandma might be sitting there in front of her TV. We're able to turn the TV on automatically. We're able to switch it, say, if she's watching Price is Right, we pop up a screen that says Costin is calling, automatically answering in 30 seconds. And then grandma can get ready for the call. And then boom, you're on the TV. Grandma can see you. She can hear you. You can have a nice 10, 15-minute visit. And then when you hang up, the TV goes right back to Price is Right, or it can even get turned off. And I just really want to highlight a key thing about our senior population and the 80 plus demographic. CDC has an estimate that at least 24% of seniors are lonely and isolated. And when you're lonely and isolated, it's something like smoking 7 cigarettes a day. It can increase your risk for dementia by 50%, increase your risk of stroke by 30%, heart disease, etc. And there have been numerous studies that show video calling is equivalent to a face-to-face conversation, and it gives the same kind of like cognitive exercise. So the more we can stay in touch with our older loved ones and visit them and interact with them, the better it's going to be for their longevity and long-term brain health. So just getting the family circle involved and doing these video calls. Also, you can send text messages and they show up on the TV. You can send photos, you can send videos from your phone and really keep this older adult as part of your life. That is phenomenally healthy for them. The other thing we've done, we've also built a B2B solution where a healthcare provider can implement this in their office. So now if there's taking care of the older population and they have a hard time coming into the office, maybe it's a rural situation, they can send them home with an on-screen device. They can get it set up, and now you can have monthly telehealth calls, even bi-weekly telehealth calls as well. However, we've also created an AI companion, and the AI companion can check in basically on a daily basis. And essentially with the AI companion, we automate the need for nurses or staff to check in, where in the morning, the AI companion can come on and say, "Good morning, Mary. Have you had breakfast already? What did you have? How did you like it?" There's a little conversation. Then, did you take your medicine this morning? Yes? Okay, great. All right, do you have any plans for the day? And the older adult can have this conversation with an AI companion through their TV, which is just, no one else has done anything like this, and it's phenomenal. So that was kind of a long talk there, Michael. I don't want to take the whole thing, but yeah, thanks for bringing up the AI companion point. Yeah.
Yeah, no, this is great. I think the two components I've heard, the AI companion, the telehealth, selling into providers, the B2B, selling into providers, selling into the health plans, especially what you were saying we were having recently about ACOs, accountable care organization, value-based organizations. Anyone who cares about their people, their members, has a new way to really stay engaged, help these members with engagement and helping those providers to engage. And I guess with the AI companion, really, it's the sky's the limit with what you can do, because essentially if there's those HEDIS measures, whatever they need to know about their members, they're able to embed in that and those texts, and then you can get it back as a CSV file or whatever it is for real data, aggregated data across, if they have how many members, if say it's a plan that might have 1,000 members with just one little bucket, and you're able to send those signals out and get those yes or no or where they are or however it be across a big swath of members, right?
Yeah, absolutely. So let's just kind of walk through that a little bit. So let's say you have 1,000 members, kind of a high risk population. You send them home with an on-screen device. Now on a daily or maybe 3 times a week, the AI can come onto the TV and say, "Hey, Mary, what's your pain level today?" And, kind of get that data point of, oh, it's a 7, it's a 3, it's a 4, and that can go directly into the EMR. So it's a verbal, the senior's just having a kind of a face-to-face chat with an avatar on the TV, but it's just voice. There's no buttons, there's no apps, there's no logins, there's nothing like that. It's completely proactive from the TV, so people won't forget about it. It just happens. And then on the back end, there's all of this, like we've got APIs, we've got integrations with EMRs that can give you a long-term picture of the patient at scale. And that's without any staff having to pick up the phone or make a call or anything like that.
Yeah, that's super cool. And where are you at right now? I guess you're always, as a founder, you're always raising, and you're always looking for partnerships. What would be the ask if someone would be able to hear you right now as this is broadcasted? What would be your ask to them?
Sure, yeah. I mean, always on the business development side of things, number one most important is more customers. So you mentioned ACOs, right? These are organizations delivering value-based care. They want to reduce their risk. They want to make sure their patients don't end up in urgent care, don't end up in emergency room, don't end up developing UTIs, for example, which is a really common thing. So for a really reasonable price per year, a few $100s a year, now they can have a virtual companion, a virtual nurse in the home of their patient with a lot of privacy controls and a lot of things that people may be concerned about. It's all covered, but they're keeping an eye. They're taking care of this person on a daily basis, and alerts can pop up. So those ACOs can reduce their risk significantly. Also, through RTM billing codes, they're also able to increase their own revenues and drive up, their top line. So our device not only reduces their costs and reduces their risks, it can actually drive up revenue for that organization.
Yeah, I think that's good that you say about the RPM, or remote therapeutic monitoring. Really, the RPM, remote patient monitoring, which a lot of people hear about, but it's very challenging to engage the members, and these type of patients typically might not be picking up their phone, and you might not, in typical traditional modalities, you would not necessarily be able to do that with remote patient monitoring. So that's what sounds like is exciting with your application, is it's really creating less friction, more likely that you'll be successful engaging those members. So I think that's very interesting.
Yeah, absolutely. Member engagement is huge. And there's also another benefit for the patient. Again, if the provider is sending them home with this device that will allow them to kind of keep tabs on their health proactively, the patient still can also get the benefit that their family can use it and call them and stay engaged with them and keep their brain going and keep them their loneliness down. So a lot of benefits there. On the fundraising side, I'm glad you brought that up. Obviously, all startups have had their challenges raising capital. When we saw that happening in the market, we just kind of decided to hunker down and focus on building a great product and getting more market fit. But there are quite a few age tech investors out there. There's also not so much necessarily age tech investors, but maybe just healthcare investors or even consumer investors. And we are out there raising a seed round right now, somewhere around $750K. Our team has been incredibly efficient in that, with a very small team, with founder and family friends money, like about $250K, we've built out the entire product, and we have paying customers today. We have, I won't say the number, but a very healthy number of paying consumer customers. So yeah, if investors think that this is interesting, I'd love to have a chat.
And I would imagine the best investor would be those strategic partners that would maybe be a health plan or an ACO that don't have the technical expertise, the device, but my gosh, they have some capital and they might want to invest in you, while they say, man, if we just might want to acquire this for, X. I'm not going to say, because could be based on how well it's going. But there's so many health organizations that are really doing more of these. I'm thinking of a Village MD that's really large, that they do a whole value-based sort of program. I could see this in their technology stack. And so anyway, the other thing that I think,
let me just say,
go ahead.
Michael, yeah, I mean, I just want to say I fully agree with that. A strategic partnership that provides capital infusion, plus also a go-to-market and a partnership that allows us to support their existing customers, that would be a dream for us.
Yeah,
so you nailed it. You
yeah,
nailed it.
that's what I'm thinking. And then you know, that has that customer base of like 100,000, and then you can just tease through the right product you know, persona, you know, because this isn't
Yep.
for everyone, right? But the other thing that I think is really fascinating that I could see really helpful is this new health equity, empowering people in their homes, senior to senior. And so I imagine you could get a cohort of diabetics or whatever that could help each other through this. Is that a possibility with the product design where, or am I getting off in the tangents in the weeds? If there was a
No.
client that said, hey, we got a ton of people that are at home and they need support to each other, can they use your platform for this?
You are so right on point right there, Michael. Because our platform does support Zoom. It can also support just non-Zoom group calls, but really Zoom is kind of ubiquitous. So there are platforms out there that provide events, community events for seniors. Again, to solve isolation, for example, or like you said, specific chronic conditions. It's like a peer group. And our product makes it completely seamless. Like you don't even have to touch anything. Once you're set up for it, the TV will come on and it'll put you into this Zoom peer group. And you can catch up with these new friends and you can talk about your issues. And it's like having a visit, like you don't even have to leave your house, but you've got, 10 people on the TV and you're just chatting there. So for folks with mobility issues, for folks that again are chronically isolated or lonely, we love when we solve those issues. And there are companies like Loop Village, for example, that do a phenomenal job. And we're looking at how we can integrate all of their online events so that our customers can just click and join one of these.
I know I had some, and I'm going to have another person soon from Impulse Mobile. They do about a billion messages a year. They support a lot of the health plans, a lot in engagement. I could see something like with a certain risk stratification of the health plans that they're working with, a cohort of members, maybe a high need, high risk members. They could use their text messaging empowerment wrapped around your hardware. I could think that's easy. So it's Impulse Mobile. I'm just shouting out there. I don't want to sideways you guys, but I'm just seeing some of what they're doing and what you could do. I think I'm super excited with what I know, with what is in store for you.
Yeah. Well, thanks, Michael. I'm super excited as well. This coming week, it's just going to be a whirlwind for us, and I'm really looking forward to kind of seeing what partnerships come out of this AARP pitch, what solutions we can deliver to this really kind of fragile population that is not often catered to as much. So there are telehealth is very difficult, for example, for 80 plus population, and isolation's huge, and it just hasn't been a solved problem. So we want to be part of that solution.
Yeah, well, I'm glad you're at a perfect place. I'm glad you've done all the hard work. Congratulations with making it to the top, the one of 5 on this pitch. I wish you success. I hope you win it. And anyway, is there anything last out you want to broadcast through the millions and millions of people on Earth and soon to be on Mars?
Oh, wow, that's a big ask. Well, all of us, we're all getting older, which is a good thing. And we want to make sure that we have a good plan for how, as we age healthy, we stay in touch, we stay social, we stay connected with family and friends, because that's just been shown to be the key to longevity. So hopefully we can be a part of that conversation. And just wanted to say thank you to you, Michael. Love being on your podcast here, and look forward to doing it again in the future.
Awesome. Well, it's great to have you, Costin. I'm so glad you could do this, and we're going to call it a day.
All right, my friend. Take care.
Friends, it has been a great journey today on Planetary Health First, Mars Next. Follow us for more on Planetary Health First, Mars Next. Until next time, peace be with you.